Tonight on Doctor's Diaries.
Renee? Hey, Renee.
She got up from the bed and she completely collapsed. So that's when we knew this was not a stomach virus.
When I asked him later, he said that actually he made a pipe bomb. It exploded and basically blown off almost his entire left hand. We're going to see if we can save this hand, okay? But it's badly damaged.
Seeing her in tubes, it's heart-wrenching. I want to take her home. You know, I have everything all set. I'm sorry.
Oh, God.
You got him?
Oh, my God. Ah!
22-year-old Todd Simmons was rushed to Westchester Medical Center minutes after an explosive blew up in his hands.
What happened?
Oh, I'm thinking.
You were what?
Ow!
I have to take a look, okay?
Me and my friend. Ow.
The on-duty resident preps Todd for emergency reconstructive surgery.
Were you drinking today?
No, nothing.
You take anything, drug?
Smoke weed.
Weed? What happened?
Ah, if you pull my hand out, I can tell you.
Okay. I have to take down this dressing to take a look, okay? You have to go to the OR tonight. We have to close this.
I didn't have much of a story of what really happened. My resident on that night had told me that, you know, this guy bomb went off in his hand, and I was like, you know, none of the pieces seemed to fit. It just didn't seem like your regular story of your normal hand injury.
What happened? Listen, talk to me. What happened? How did you blow up your hands?
One of my friends said I was, wow.
You're not making any sense. From the history from the EMS, they said the firecracker, but then when I asked him later, he said that actually he made a pipe bomb, and him and his brother passed it along to each other, and then somehow it exploded and basically blown off almost his entire left hand. We're going to see if we can save this hand, okay? But it's badly damaged.
I was called, and I essentially was taking laundry out of the washing machine, putting it into the dryer, and getting ready to go to bed. And I got the phone call, and I immediately just dropped everything I did and jumped into my car. As soon as I got here, jumped into a pair of scripts. He was already waiting for me in the operating room.
It's nice to have you.
Thank you very much, too.
9-year-old Dritan has just arrived in New York from his native Albania. He suffers from a serious heart condition that threatens to cause a massive stroke which could kill him if not corrected soon.
Hey, you want to try it on? Huh? It's a little big, probably. Here you go.
Thank you.
All right. You're a New York Yankee now.
Yeah.
Dritan is a participant in an international program called The Gift of Life, through which critically ill children in less developed countries are given the care they need. It is at Westchester Medical Center in Valhalla, New York, that Dritan will get the operation which will save his life. His first visit is with Dr. Paul Wolf.
What he has, from what we know about him from home, is that the big vessel going out to the body, okay?
Aorta?
Yes. It has a narrowing here.
Yeah.
It's blocked. Today, here, right, this afternoon, we're not going to be doing any surgery. Nothing will hurt. So we're all going to go to the room next door, and then we take a picture of your heart, like you had at home. We use a microphone. I first became involved with the Gift of Life several years ago when I was asked to accept these children for surgery at our hospital. Now, with this picture, we're looking for the aorta. This is the aorta, the major vessel that comes out of the heart. And these are branches that go to the head and to the arms. And you see it comes down to here, and then it gets narrow. This is where the blockage is, right here. So that's the area that will have to be enlarged by the operation. When he would try to play and do the usual activities for somebody his age, he became short of breath, his legs hurt a lot, and he really was not able to do the things that other boys his age could do. So that was certainly very sad to hear.
It's been 2 hours since Todd Simmons arrived in the ER.
The proximal phalanx is in pieces.
Dr. Karen Buckley examines the x-ray and discovers how badly the explosion damaged the bones in his hand.
Not too bad, just soft tissue. Yeah. Every patient requires custom-made procedures, and you have to think it out ahead of time. And I have to admit, a lot of the time you think it out in the operating room. Alrighty, well, the big problem is the soft tissue. Let's see what we can do. You're standing there, you have plan A, plan B, plan C, and plan D already in your mind. Sometimes things still don't work out completely the way you want them to. If you knew? Yeah, I know. Maybe you would have stayed in bed this morning.
Todd's injuries are severe, and Dr. Buckley must quickly determine her exact course of action.
I don't think there's much I can salvage here. I mean, I'm trying to assess everything. I mean, there's blood supply to some of the soft tissue, but it's not going to do much good to have soft tissue when the bone is really not very good. It doesn't look that bad on the x-ray. In Todd's case, I wanted to save something on both hands, and his left hand especially.
All the fingers are going to go?
No, I'm going to try to save these two.
Yeah.
I'm going to try. If he can end up with a claw that he can use to assist his right hand with, you know, that's something that's better than having the entire hand taken off. This is probably one of the saddest operations you can do, is amputating parts of a hand. I think one of the things that kind of intimidates me with hand surgery is the fact that I could have done a very good job, but at the end of it, I don't know what the recovery is going to be. I don't know.
Coming up, will a 6-year-old girl slip away?
Hey, Renee. Renee, stay awake for us, darling.
Renee, how old are you? Renee. Hey, Renee. You say hi?
When it happened that night, I was holding her in my arms, and she was like a rag doll. And I thought right then and there, oh God in heaven, what am I going to do?
Little pinch.
When 6-year-old Renee Young was rushed to the ER at Westchester Medical Center, she was in diabetic shock.
I'm sorry, honey. I'm sorry.
Still unresponsive, she drifts in and out of consciousness.
Initially, Monday, she was complaining of a stomach ache. We thought it was a stomach virus.
Renee. Renee. Hi, hon.
She started getting extremely lethargic. So finally, the last time, Thursday night, she got up from the bed and she completely collapsed. So that's when we knew this was not a stomach virus.
I'm sorry, honey.
In a serious situation, a diabetic has an extremely high blood sugar level.
Renee.
Hey, darling. There you go.
Renee. Gotta stay awake.
Doctors are afraid that Renee, with a blood sugar level 8 times higher than normal, will slip into a coma.
Renee? Hey, Renee. Renee.
This morning at about 2 o'clock in the morning, I got a phone call that there was a liver available for one of our patients. And the operating room time was going to be about 6 in the morning, but it was going to take several hours to get there. So I came in the hospital about 4 o'clock this morning.
Hi, we're here.
Happy to see you, Doctor.
Dr. Jim Piper's transplant patient is Mr. Vicente Tejada, who's been waiting for a liver for more than 2 years. Dr. Piper started the liver transplant program at Westchester Medical Center 4 years ago.
Can someone answer that? Joanne, can you? Is that Dr. Lim?
Hi, Trader.
Ask him if he wants to come up and play.
Oh, if he doesn't play, he works.
Lynn, tell him not to come up because we're going to have fun.
Because they're going to have fun.
If I get a donor call, I must think about it a lot because I can never get back to sleep. If I get a call in the middle of the night about a patient, I can answer the question and go back to sleep within a minute or so. But if I know that I've got to get up in an hour or 2 hours and go out and get the organ, I'll sit there and just stare at the clock. And we need one more little intestinal bag, you know those little intestinal bags?
As Mr. Tejada gets prepped for surgery, Dr. Piper prepares the donor liver to minimize any complications during the transplant.
So after we get the liver out, it's still's got a lot of stuff on it we really don't need and want. So usually once we get back here, we just kind of clean it up a little bit. We're just checking the artery to make sure there are no holes in it. This is the main artery that feeds the liver. That looks really good. We'll just wrap this up and then we'll get ready to get started. I knew I wanted to do surgery ever since I was in high school. Actually, between my junior and senior year, a friend of ours who was an obstetrician gynecologist got me a job as an orderly in the operating rooms at a hospital back in my hometown. Fell in love with it. Probably the 37. Or 27. 27 is probably okay. He's not that big. I decided on transplant because cardiac surgery, I think, is a very exciting field and one I would have been happy in, but it's doing the same operation day in and day out, and I thought that that might get boring with time. Another tubing clamp, please. Okay. Are we ready to go on and try and see what we can do? Let's see what we can do.
It's almost time for Dritan's heart surgery, but Dr. Wolf needs to put the scared little boy through one final test.
And this is a morphine in a syrup form.
To drink?
Head back.
To drink?
Okay, I'll let you. No. Don't spit it out.
Bye-bye.
See you later.
It's wonderful to be able to offer children the knowledge that you have and the skills that you've acquired and help them. It's a great feeling. And you have to realize while you're putting them through any procedures that you do or any temporary discomfort, you know that you are putting them through this for a greater good, for a greater end where they will benefit. So as long as you know that, then it's much easier to do.
It's okay. It's okay.
His blood pressure, because of the delay in treatment from Albania, the blood pressure may stay elevated for months to maybe a year. So he may need anti-high blood pressure medicine in order to help that stay low. So you can see this is the artery, right? That's why it shot across the room, and it's pretty red. You really can't avoid the blood loss when it's the artery in a big kid. Okay, so right now I'm just putting the catheters in and recording in a few minutes. Go!
Dr. Wolf injects a harmless dye into Dritan's aorta.
His left subclavian is huge. Look how big it is.
It shows exactly how the narrowing in the vessel is limiting the blood flow to the lower part of his body.
So you see the coarctation.
Yeah. Wow.
And it really goes from there to there. We should have asked how you say finished in his language.
Oh, right.
I want to know that. Okay. Hi. Hello. Okay. We're all finished. All done. The hardest thing about taking care of gift-of-life patients who come from other countries, it's very frustrating. You try to communicate and reassure by body language or facial expressions, but that can only go so far. Okay, all done. Bye-bye.
Bye-bye.
Bye-bye, all done. Anybody had not as they finished in Albania? Yeah, we can have the guy come up. That's a good idea.
Yeah, tell him we're off to, he can go back to his bed.
Everything went very well.
Thank you.
We got very good pictures of everything. It's very severe.
Yeah.
He slept the whole time. He was asleep the whole time.
Yeah.
But at the end, he wakes up.
Yeah.
So we just wanted to tell him we're all done and
Yeah.
everything is fine.
Ka përfunduar çdo gjë, ti je mirë.
Ka përfunduar.
Çdo gjë, ti je mirë, ke dhimbje? Jo, ka përfunduar çdo gjë, ti mos u bën marak. Çe ku jam unë?
For more information, log on to our website. Next on Doctor's Diaries, a mother is forced to leave without her newborn.
I packed a bag. You know, I have everything all set. I'm sorry.
Dr. Karen Buckley has been in the operating room for 5 hours trying to repair what's left of Todd Simmons' hand.
The good news is, yeah, I see. The good news is, look at this lovely padding we have on this thumb tip here. Bad news is his thumb is a lot shorter. And these injuries are a bit intimidating at first when you come in and you look at them. You know, he had a lot of soft tissue damage. He's lost half of his thumb on the left hand, 2 of the fingers, and we've got 2 fingers that I don't know what the function is going to be ultimately, but hopefully he'll get some motion back, and most importantly, he has part of his thumb. You sure you don't want a skin graft now? I got plenty of skin graft over here. You want to give it a try? Put it on as a biologic dressing? When you're midway through a procedure like this, you kind of settle in because it does become kind of fun putting something like this back together, trying to salvage. You know, you're essentially handed something that is completely non-functional, and you try to see what you can make out of it. Skin grafts and bone grafts, and using them, you know, in different places. It's like a puzzle, huh?
Yeah.
I always tell my patients that what we do, even though it seems so arduous, is about 10% of the ultimate result, maybe even less than that. The other 90% is physical therapy and their participation in it. And even if they participate fully in physical therapy, they still may have a very rough course and may require further surgery. I think all the explaining in the world is probably not going to set it straight with him that, you know, we're not the ones who created this injury. He's going to wake up without his hand. He's going to be blaming me.
It's been 8 hours since Renee Young was admitted to the ER, diagnosed with life-threatening diabetes.
We need to get that blood sugar down slowly, but we need to get it down to a level that's she can be conscious and be okay. Sometimes a nurse is there just to be a shoulder to cry on. These parents are very upset that their child is here and will be here in and out for a long time, and you're there to be comfort to the family. And it feels great to do that and be there for them in that way.
We do 3.5. Now, let's think. What is the total number going to be when you draw back the 3.5?
Let's see, that's going to be 5.
Very good. So you're going to draw back to 5.
No? Okay, if you don't want
A lot of times parents are shocked when they get this diagnosis and they almost put up a block. Cindy was not that way. She wanted to learn and help her child.
How's that? Is that too much? Is that okay? That is perfect. Good job, Mom. High honors, again.
We'll do this one because we did the other one the last time.
Will Daddy do it?
You didn't do all the work, so you can't.
Mom's getting credit for this one.
You ready? weren't supposed to say ow on camera. Okay?
Good job.
There you
Perfect.
go.
Now you can have dinner.
Now you can eat, kiddo.
Okay? What do you think? Did Mom get an A?
Yeah.
Yeah? Okay.
We so quiet.
Is that a leaf?
Yeah. It's good for you.
It's a lifelong thing. There's no growing out of it. You know, she's type 1, and that's forever.
Five-day-old Madison McGuire Bacata was born 2.5 weeks premature.
She was preterm. She was about 5'7" when she was born. The reason why they delivered cesarean, which they were going to do anyway, but at 38.5 weeks, not 36 weeks, my amniotic fluid came down, and it was really low. The surgery, you know, it went as planned, and they said everything went beautifully during the surgery. When she was pulled out, she had sucked in fluid.
Because Madison was born prematurely, her lungs are underdeveloped. She must remain on a respirator until they can mature and clear of fluid.
In order to help them maintain a normal body temperature, they're placed in an incubator usually until they're able to better regulate their own body temperature.
Right now she's on oxygen and she's in an incubator, but hopefully that won't be long. Walking in there and seeing her in tubes, it's heart-wrenching. She had a oxygen tent over her face and she was not breathing well, but she's breathing on her own. It's something you're completely unprepared for. You don't expect to have an unhealthy baby. I guess your concerns are more of 10 fingers, 10 toes, and you know, everything's intact as far as, you know, how she looks on the outside. I want to take her home. I have to go home without my baby, you know, and that's something you definitely don't prepare yourself for. I packed a bag, you know, I have everything all set. I'm sorry.
When we return, a young boy's courage wears thin.
Clean a bosta.
Four hours into the transplant surgery, Dr. Jim Piper works to remove Vincente Tejada's diseased liver before unpacking the donor organ.
Okay, right angle to me, pick up scissors to James. He is a very interesting gentleman. He has hepatitis B, and the donor had been exposed to the hepatitis B virus in the past, which most people would not be willing to accept those livers but for the fear of getting hepatitis B. 4-0 double-armed on the 27. Since he had hepatitis B, and he was already going to be treated for the hepatitis B, and so that was a perfect liver for him. One of the red pullers.
Bad liver.
This gentleman clearly had cirrhosis of liver, and the first thing you noticed with the liver that we took out was very rough. It looked like a cobblestone street, and that was the cirrhosis. It was small too. As it gets cirrhotic, it shrinks down. So I guess the two things that really set it apart was that it was very rough in texture and it was smaller than the liver we put back in. The liver is one of the most amazing organs in the body. And one of the most amazing things about it is its ability to get to the size that it needs to be. If we take a small piece of liver, and if that liver is not big enough, it'll rapidly grow, literally over a week, 10 days, to the right size. And more amazing is if we put it in and it's too big, it'll shrink down over the course of 5 days or so to the right size. So something tells the liver exactly how big it needs to be.
Tell him that it's very normal to be a little scared when you come into the hospital.
Dr. Lester Permit comes to visit 9-year-old Dritan a day before his surgery.
I came by to talk to you a little bit about exactly what we plan for his surgery tomorrow. It's always more difficult dealing with patients and parents who do not speak English or understand English well. It's difficult enough to carry out a normal conversation through a translator, but when I'm trying to convey relatively complicated concepts of the surgery and the risks involved, that becomes even more difficult. This is a diagram of what the heart looks like.
Yeah.
But in Dritan, there is a narrowing in the aorta that occurs in a pretty typical location. And the two choices would be either to completely remove the narrow area, as I've shown here, cut it out, and then sew the two ends together, or to make a cut across the narrow area and put on a patch to enlarge the vessel in that area. I think it's important that he knows that we're going to fix it tomorrow.
Yeah.
We don't have to tell him a lot about the details, but he should know that tomorrow we're going to make everything better.
Yeah.
In Dritan's situation, the main problem is that the upper part of the body has such a high level of blood pressure that he's at risk for all the sorts of things that an older person with primary high blood pressure might succumb to. Heart failure, stroke, and the development of aneurysms that can rupture and cause severe brain damage or even death.
Dritan. Zdjęcia, bożki, no? Czy... Gdzie flash? A si žensko. Skoro žamo. Plina božka. Počekaj. Plina božka. Plina božka, skurdi je vetëm kontrol dhe të bojnë, apo atë aparaturën atë. A si žensko dhe të bojnë. Vetëm atë. Vetëm atë.
After being incapacitated for 3 days, Melanie McGuire is finally able to visit her baby in the NICU.
This is the first day I'm walking on my own. I was taking a wheelchair and kind of walking on the back of that, or walking with my mother, you know, with help. And now I can go down there by myself, which reassures me that when I go home and I want to come back, that I can do this on my own, as opposed to having someone hold me the whole way there.
Parents do not understand, especially when they first encounter their baby in the NICU. It's a very overwhelming environment. There's a lot of noise, a lot of sound, a lot of beeps, and it's very, very easy for them to be distracted from the baby that's actually laying there in front of them.
Let's see, it's at 40. I keep checking this to see if it's at the right level, because she was
Not for you.
I know.
For us.
She
Don't look at this. It goes up and down.
Yeah, I know.
Okay.
I know.
You come and look at the baby.
I know. I want to make sure that this goes down, though.
It will go down with time.
I know.
Just give time.
I know.
Have lot of patience.
I know.
Okay.
I don't have any patience. I want to go home now.
No. You will have. You will develop patience. Wait and see.
It's okay if I reach in? Or? Okay. Just put this up.
Hi, lovey. Would you like to hold her?
The nurses are wonderful initially at just sort of orienting the family to the environment, and then really just getting them to focus on their baby.
Okay.
Okay. And I'll straighten her up for you. Okay. This here is not.
Yeah.
Not
No, we'll put this over here.
That's okay. That's okay.
I'm probably we'll tape it to your bath rope so we
Okay.
can just. Hey, where you going? Where you going, miss? Here, let me just. Okay. Okay. She likes her binky. Hi, boo boo. You want to show mommy how you suck? Show mommy how you suck. She's like, no, not yet. Forget about it.
Hi, honey. Well, you're not getting up as upset as you were before. You used to get awful upset. You're sleeping. And I know that's the best way to be comfortable, just to be sleeping. Huh? Just to be sleeping. As long as you're sleeping, you don't know what's going on. That's the best thing. Just sleep right through it.
Just ahead.
When we brought her in, I would have given anything to see that.
In order to care for her diabetic daughter, Renee, Cindy must learn to change her family's eating habits entirely.
But I have a list, but I don't have like a huge list of what exactly
is a protein, what's a carb, the exchanges. She didn't give you that?
No, I have the exchanges, but I mean, there's got to be so much to each food group, you know. I mean, like she mentioned like the Teddy Grahams, vanilla wafers, but there's so.
Well, you know what you can do? You can turn the box around and see how many carbohydrates.
I'm gonna have to do that.
Right, you're gonna have to read labels.
It's gonna take me
You're gonna get great at reading labels.
It's gonna take me like 3 hours to do shopping. I have to read every label.
At first, but then you'll get used to it, and you'll always.
We'll be fine. I'm gonna miss you. She's been great. She's been so great.
My job is to get them accustomed to what they need to do to have a healthy child.
Yeah, honey, look. You see this? This is important. You have to eat that right now, okay? You want me to put the tomato on there? You want to eat it like this because you have to eat it, hon. You have to.
It feels great to teach a parent something or a child something and have them get it.
Can I have this?
No. You can't, because it's too many carbs, hon. You gotta have a certain balance, all right?
With each day, Madison's lungs grow stronger, but she's still not breathing properly.
Her respirations have to slow down a little bit. She's breathing above 60. She should be between 40 and 60 breaths per minute, and she's like 68, 70. So that needs to slow down, and she has to be able to eat, with a bottle or breastfeed before she can go home, and that puts a lot of work on her breathing too right now. So we're not even feeding her that way. We feed her with the tube now.
She's very pretty. Madison's a pretty girl.
They may want to see the baby eating well for at least 24 hours before the baby can go home, eating and breathing well.
From what I'm gathering, that it's going to be possibly a week, this weekend, so it's only going to be maybe a few more days, before she can come home.
The desire always is to take their baby home. So I don't think ever is a parent happy when they get the news that their baby's discharge is going to be slowed down or affected by, any given condition.
I wanted to stay as long as possible till she's perfectly healthy, but I want her to come home at the same time. I don't want any complications beyond this. I want to take her home. I want her to be perfect.
We're not intentionally separating them from the family. We just want the baby to have the best possible outcome.
Aww.
So cute. Hi, baby. Yeah, she's still requiring a little bit of oxygen by the cannula, but hopefully within the next day or so we'll be able to get that off. She seems to be, tolerating her feedings fine. You can tell her color's a little yellow. She's still a little jaundiced. The first place you can really see jaundice on a baby is over the bridge of their nose. So if you press like this, you can still see how. And generally, as the levels of bilirubin are rising in the bloodstream, it progresses. It starts from the head and works its way down. But she's 8 days old now, so her levels are going to start to come down on their own, which they are. So I'm not so worried about that anymore. But she's doing great. Madison Rose, very good. Baby McGuire will be going home tomorrow.
Yeah.
His roommate are ad lib Q4 feeds now, so it's okay for me to tell the parents?
Yeah.
Okay. My experience has been really, really good. I think what it comes down to is that when you work in an environment like a NICU for as long as I have, it becomes a part of you and a passion for you.
Good girl, sweetheart.
That's why I've been here all this time. It's just a deep love for the children and the patients that you take care of every day.
Little Whopper Junior Cheese.
Madison's prognosis is excellent. I think that she'll do really, really well outside of the nursery. I'm really looking forward to having kids, and I've been looking forward to it for a long time.
Thank you so much.
Drive safe. What sort of happens to you when you work in this kind of setting for as long as you do, you tend to think that every baby is going to be born either prematurely or with a problem, and you forget that babies are born every day all over the country well and healthy, and you definitely, I'm in my mid-30s, and you definitely get a strong, strong maternal instinct, and you just hope and pray that everything happens in time, and that someday I'll be blessed with children of my own. Definitely.
Sweet girl. Hey there.
It's been 5 days since Renee was rushed to the hospital unconscious. Her diabetes is under control, and she's finally able to go home.
When we brought her in, I would have given anything to see that. You know?
I can't believe I'm going home. I can't believe I'm going home.
Oh, you're welcome. You're welcome.
Bye.
Good luck to you.
Okay.
You guys are leaving?
Yeah, we're leaving.
Discharge.
Discharge. We're out.
Okay, nobody told me. Oh. Let me give you a hug. Renee? Good luck to you.
Oh, I'm sorry.
I think Cindy and her husband were somewhat nervous to leave, but I think that they thought they knew enough, to get by on the first few days.
So she'll take the amoxicillin, 1 teaspoon, which is 5 cc's. Okay, that's 1 teaspoon.
She knew she could do it. She was just a little shaky, but I think we gave her enough confidence to feel okay with going home.
Look at Renee. This is your first time outside in 6 days. Yes. Even though we know technically we're not going to be alone because the doctors are always going to be in touch, it's a whole nother experience when you're walking out of that hospital and you're saying, okay, I've graduated now. What am I going to do now?
When we come back, after dozens of doctors and thousands of miles, for Dritan, it all comes down to this. While on rounds the day after the liver transplant surgery, Dr. Jim Piper visits his patient, Vincente Tejada.
Let's just take a peek here.
Look at that.
Beautiful. All right. All right. It's less than 24 hours after his surgery. He's going to be going up to the floor today and getting out of the ICU. He's not bleeding at all. His blood counts are all stable. His liver looks like it's functioning well. Again, this is probably a little bit better than we would expect most people to be doing, but it's not that unusual for people to do this well after transplant. 24 hours ago you were just finishing your transplant. You're looking pretty darn good. Okay?
All right.
Tomorrow we'll see you up on the floor. All right. Bye-bye. In process. You gotta love it.
For more information, log on to our website. Back home, Cindy Young has stocked her kitchen full of foods that will help her daughter Renee keep her diabetes under control.
We've got applesauce. I still haven't been able to get Renee to eat this. Grapes, carrots. All this stuff used to be foreign in our refrigerator, but now it's not. These are all the needles and the prickers, the lancets, I guess you call them. I call them prickers. We keep them in the soda bottle. I think what we're probably going to be experiencing now is the living of it. She's getting all shy now. What's the matter, Renee? We came from being as low as you could possibly be
You know, we were on the verge of losing our daughter. I can't even describe to you what that was like.
I think Renee will lead a normal kid life. She's a normal kid. She just has something different that she needs to do in order for her to be healthy.
Who's that?
Bubble,
Yeah.
Blossom, Buttercup.
Oh, wow, and I didn't even know their names either. You're so smart. Is that her bus? Yeah, that's your bus. Give me a hug. I'll see you. Have a good day, sweetie. You can't turn back the clocks and say, okay, she doesn't have diabetes. Okay, we don't have to do this anymore. Hopefully one day, thank God, they'll find a cure and she won't have to deal with this and we won't have to deal with it. But in the meantime, it's here, it's right in our face, and we have to.
It's finally time for Dritan's heart surgery. He has traveled over 4,000 miles from his home in Albania because in his country, the technology does not exist to perform this operation.
Vicky, do you have any jokes? It looks so serious these days.
Each doctor involved is volunteering his or her time and experience to help him.
Hi. It's okay. It's okay. We'll take good care of you, okay?
Dritan is Dr. Permit's 27th gift of life patient to date.
That's good. And give my kiss. Huh? Yep. Stop. Okay. Down here is the area where he's got that very, very tight narrowing. And then you can see that as we go lower, it becomes more normal sized again as it descends down to the lower part of his body. The problem is he's got these huge collateral arteries here and behind that would make it very difficult to make. We'd have to cut out from here to here and get that all together, which I think would be difficult to do. So instead of doing that, we'll put a big patch on to just enlarge the area from here to here, and I think that that will do very well for him.
The patch Dr. Permit uses is made of Gore-Tex and will remain on Dritan's aorta for life.
Although the patch will not grow, once we enlarge the area and blood flow starts to come through the artery, the remaining portion of the wall that's made up of his own native tissues will grow over time, and it's unlikely that he'll ever have any further problems from this.
Yoo-hoo. You can see me, right?
All done. He's in the intensive care unit. Everything went very, very well.
Oh, thank you.
No problems at all, really.
Everything is okay.
He looks perfect.
Okay.
He's asking for something. I don't know whether it's for you or for water.
Dritan. Çak içeri. Çay tukar ku. Uj. Uj. Huh? Uj. You like it water.
He's going to be pretty sleepy for a while. And his belly, we're not going to be able to feed him for at least 3, 4, 5 hours, nothing to drink.
Yeah.
Because with the increased blood flow, it can also affect
I her për herë skema është uji po mrapa do t'i japim ujë.
nothing for 4 or 5 hours.
But we'll give him some ice chips. Something.
Kush? Me linën tonë ta japon. Ta kam mbrujt.
My sister lives.
He like it cola.
Not until later.
By the next afternoon, Dritan's blood pressure has equalized, and he is making a typical recovery. He's scheduled to leave the hospital within 3 days.
All right? Okay. 4 feet. Okay, have a seat in the chair.
Can you lie down now for a second? That's nice and clean. This looks beautiful. I think all these patients who come through the Gift of Life program do become special because you're aware that you're part of a bigger process in the first place.
Yeah.
Oh, thank you. Thank you very much. Oh, those are beautiful.
This is for you.
I don't need this.
Cheers, Dritan. Dritan, cheers.
The expression of that gratitude really comes across much more emotionally in these patients because they really feel that if you didn't take care of them, there was no one else who could have done that, and that they might well have either been very sick or even died.
So, goodbye, thank you, Lucy.
You're very welcome.
Good evening, ladies and gentlemen, and welcome to Swiss Air Flight 103 and American Airlines Flight 63.
Having had this surgery, Dritan can now return to Albania and begin to lead the life of a healthy 9-year-old.